Hi. When a person told his friend that he has depression, the friend asked, "Why should you develop depression? Everything is going well for you. There are no stressors at work. Your personal life is fine. Your children are doing well. Why on earth should you have depression?" Can depression happen in the absence of stress? Can depression develop even when everything is going well in one's life? Let's explore. I am delighted to welcome you to another episode of Mindscape Matters, a channel to discuss mental health and more. I am Dr. Mohan Raj and I'll be with you as we discuss about various facets of mental health. Stress can be relative. What is considered as stress may not be considered by another person as stress. For our discussion, let us take some real life examples. Mr. A, B and C. And we'll also assume that all three of them are from the same socioeconomic background and are in similar jobs so that the stress would be the same for all of them. Now, Mr. A encounters a stressful event in his life and gradually develops depression. Mr. B also encounters the same stressful event, but he does not develop depression. Mr. C, on the other hand, has no stress. Everything is going well in his life. His work, family and personal life are doing well. But he felt low for a few days and in another 2 weeks he developed depression. These three persons are representative of many people in the community. Now, what is happening here? We will come to that in a moment. Depression is caused not by just one factor but by multiple factors. We can understand these factors by classifying them into three large domains: biological, psychological and social. Biological is a term given to denote everything related to our body. It includes genetic factors, our brain chemistry, the neurotransmitters in the brain, and bodily factors like having hypothyroidism, etc. Psychological factors refer to how we perceive our environment and how we interpret what happens to us. We had discussed this in an earlier episode called The Way We Think. I have given the link in the description. In addition, it would also include whether we have adequate coping skills to deal with the stressors, and it also includes our personality traits. Social factors refer to many environmental stressors that can happen to us like poverty, social isolation and discrimination, and stressful life events. In any given person, more than one factor could be operating at a time. We can understand the causative factors or risk factors in another perspective also, that is, as predisposing factors and triggering factors. I'll explain. Predisposing factors are those that predispose a person to develop depression. When I mean predispose, what I mean is those factors that increase the risk of the person and make them vulnerable to develop depression. A person might go on for months or years without developing depression in spite of having a predisposing factor. Predisposing factors can be from all the three domains. It could be a genetic vulnerability with family history of depression in some first degree family members, or it could be the vulnerability in their brain chemistry. Certain illnesses in body organs and certain medicines can also predispose a person to develop depression. Or the predisposing factor could be a psychological factor like thinking in patterns that are anxiety provoking and self-defeating. Or it could be having poor coping skills. Social factors include, as I had already mentioned, poverty, social isolation, lack of freedom and many others. There are certain risk factors known as triggering factors. Now, these factors are stressful events that can trigger depression in a person who is already predisposed to develop depression. Triggering factors can be sudden loss of someone dear, or loss of wealth, or loss of face. Or it could be a disappointment like a breakup, failure in exam, or not getting a job, etc. We have looked at some of these factors in earlier episodes, like a few episodes on grief, on breakup, and also our needs as described by Maslow, and what would happen if these needs are not met. I'll give link to these episodes in the description for those who have not seen them earlier. Now coming back to our friends, Mr. A, B and C. Mr. A and Mr. B encounter the same stress, but Mr. A develops depression and Mr. B doesn't. This could be because Mr. A is more vulnerable to develop depression. The vulnerability could be from any of the three domains: biological, psychological, or social. And when the triggering factor happened, he developed depression. On the other hand, Mr. B probably has no predisposing factors. He is not vulnerable, or he could be having good coping skills to deal with the stressors. Though impacted by the stress, he did not develop depression. Now, Mr. C had no stress of any kind but developed depression. This could be because of the presence of high degree of biological predisposing factors. Here, depression can develop without any social or environmental stressor. In clinical practice, no person would have only social factors or only psychological or biological factors. It will be a combination of all the three in various degrees. The psychiatrist's responsibility includes, in addition to diagnosing depression, teasing out the various causative factors and how they interact with each other. The treatment will be planned for each person depending on what their causative factors are and how they influence the person's mood state. Let us discuss about some of the causative factors in detail in the next few episodes. Thank you for watching this far. If you like this video, please tell 4 of your friends and tell them there is a Tamil version also. Stay tuned because Mindscape matters. Bye.